Hi, my name is Ryan. I'm one of the nurses here at Success Rehab. Today we're going to discuss diabetes and managing this disease with our clients. So a little overview about diabetes. This occurs when your pancreas doesn't create insulin or does not create the appropriate amount of insulin. You could have too much insulin production or not enough insulin production. What insulin does is it binds to sugar in your blood cells and it causes a decrease in sugar in the bloodstream. That sugar should be in the cells. Your cells need that sugar. So without this, there is too much sugar in the blood, and that means there's not enough sugar going into those cells. Typically, diabetes is controlled by diet, physical activity, medications, and sometimes can include insulin. Success Rehab does not administer insulin per our medication policies and procedures. Two different types of diabetes. The first one is diabetes type 1, not typically seen at Success, but this one is usually diagnosed in childhood, and this is when the pancreas just does not produce insulin. This means that the person is insulin dependent. Again, we don't administer insulin here at Success, so you're typically not going to see this. Type 2 diabetes, this is the type that is most common in the US, but also here at Success Rehab, this is what you'll see. This can occur anytime during the lifespan. It could be a cause from poor diet, lack of exercise, natural changes, or aging in the body. This person that has type 2 diabetes may or may not need medication or insulin. Typically, they'll start off least invasive, and you'll start with diet and exercise. You might need medications up into leading to insulin. Tips for preventing and managing this disease. Like I said, encouraging physical activity and following the diabetic dietary or nutrition guidelines are very important. When somebody is diagnosed with diabetes, if they're prescribed medications, it's really important to follow the medication regimen. In addition to that diet and exercise, you want to still continue that encouragement. Blood sugar checks, they're also known as BG checks in the MAR. They must be performed as the doctor ordered them. So some doctors will order a blood sugar check to be checked daily in the morning before breakfast, twice a day, 2 hours after meals. And they might say Monday, Wednesday, Friday. Whatever the order is, it's in the MAR. If a client is diabetic, really need to make sure that the glucometer is kept in the med tote at all times if they're at Clymer, 11th Street, or Dublin Neuro Rehab throughout the day. So checking blood sugar levels. This is important because it lets you know how much sugar is in your bloodstream versus how much sugar is in your cells. So labs, medical provider, whether it's the primary care provider or an endocrinologist, whoever it may be, they might order routine lab monitoring. Typically, everyone's ordered routine lab monitoring to screen for diabetes as well as other conditions. And if they really want to screen hard for diabetes, they'll use a hemoglobin A1C, and that measures sugar in your blood for about 3 months prior to getting that blood drawn. So if you're taking a client for blood for lab work in the morning, make sure you're paying attention to if it's fasting or non-fasting labs, and you really need to make every effort to get that client there on that day that it's scheduled, because that is when the provider would like the sugars checked. I know that can be tough at times due to many different circumstances, but we really need to try and make sure that that is done. So glucometer, that is the device that is handheld, measures your blood sugar levels. It involves somebody pricking your finger and you getting a little piece of blood and you actually testing that blood to see how much sugar is in it. Glucometers are trained in the med administration course, so if you're med trained, you have had training on glucometers and you're expected to be able to use them if you need to use it. If you're not med trained, you're not expected to use a glucometer. Now, glucometers, it's really important to note here that glucometers are for that specific person. So if I'm working at a house or I have 3 clients with me and 2 of them are diabetic, I need to make sure that I have both of their glucometers with me if I'm coming to Clymer, Dublin Neuro Rehab, or 11th Street. Do not ever use a glucometer that is assigned to somebody on somebody else. So I would not use client 1's glucometer on client 2. Make sure you have both of their glucometers. That's not only a state reg, but that's also a safety and infection control issue. So some other devices that we see too, there's something called a Freestyle Libre as an example of that, where it's something that's implanted in the skin and there's a device that you swipe around it and it tells you what the blood sugar level is for that client. If you're not sure how to use those and you have a client in your house that has one, there should be some education there at the house for you. If not, reach out to nursing and we can help. So monitoring blood sugar levels. So the numbers you get when you use that glucometer tell you how well or how poorly the client is doing controlling their blood sugar and insulin. So all of the offsite locations have a diabetes chart in those white binders where the med count sheets are located. In Climber, the count sheet book there as well, the white binder that has the med counts has the chart. If you're ever in there and there's not a nurse there, you can look in there to reference. So blood sugar ranges, our levels here at Success, we want to keep everyone between 70 and 180. Other settings like a hospital or somewhere else you may have seen before, a little bit different protocols, but this is what we'd like to maintain for the best health for our clients. So what happens when the sugar gets too low? That's called hypoglycemia or low blood sugar. So when your blood sugar is less than 70, you might appear with some symptoms of shaky, sweaty, cold skin, nervousness, dizziness, confusion, fatigue, weakness. The saying always is cold and clammy, need some candy. Interventions for this. So if you take somebody's sugar and it's below 70, do not administer medications until you call nursing, because we will instruct you what to do with that. Also, don't give them food or anything yet. Call us first and we will help. We would say something like maybe, okay, give them a half a cup of orange juice and recheck the sugar in an hour, or recheck it in 30 minutes, give them a snack. We will tell you specifics on what to do. We might say you need to hold that person's medication for the day, and we'll tell you which medication to hold. So if the sugar's too high, that's called hyperglycemia or high blood sugar. This occurs when your blood sugar is more than 180. Symptoms of this could include increased thirst, increased urination, hunger, dry mouth, blurry vision, weak or tired, hot and dry, sugar high. Interventions for this, again, don't give medications right away. Call us first in nursing and we will help you through that. While you're calling us, I'm going to tell you right now, 99% of the time we're going to be telling you to give somebody some water and recheck their blood sugar. So already start before you call us. Give them some water and call us at the same time and say, hey, this person's sugar is whatever it is. I started giving them water. What else would you like me to do? And sometimes we have clients that have certain guidelines, or sometimes we have things that we have to take into account given different comorbidities, and we will tell you and provide some instructions and support for you on what to do next. So common complications. This is uncontrolled diabetes. This is also sometimes somebody that is controlled with diabetes might have some of these things as well. So diabetic neuropathy. This occurs when somebody's feeling is lost in an extremity, and it's usually the lower legs and feet. So this is really important if you're helping a client with their ADLs, if you're helping them shower, get dressed, or any of those ADLs, please pay attention to their feet. If you notice any new abrasions or marks or anything like that, notify nursing right away, because we will look at it and then we'll also refer to the appropriate specialists to help come up with a good treatment plan for them. Because my next point is impaired wound healing. So when somebody is diabetic, there's a lot of issues with wounds healing, and they don't heal very well. They don't heal quickly, and there are many issues for that. There's special treatments for wounds for individuals with diabetes, and it's really important to catch any issues early so treatment can be minimal and successful. The last point here is insulin resistance, and I just wanted to add this because this just involves if you are noticing that your clients are constantly, you're calling nursing every day for the past week and you're like, hey, can you please look into this? Chances are nursing's already on it, but it doesn't hurt for you if you're doing direct support staffing with these clients and helping them, and you're noticing these things, to also bring it to nursing attention so that we can look at and see what is going on. Is there a lifestyle change? Does this person need a medication adjustment? Because as people age, sometimes medications need to be adjusted in individuals with diabetes specifically, because the body is getting used to the incorrect amount of insulin, especially if somebody has uncontrolled diabetes. So always know that if you're providing direct support for clients, you are the first line of defense to try and help advocate for them. My last slide here is diabetic coma. I'm not going to get into too many details about what happens with this, but this is when somebody's blood sugar is either way too low or way too high. So if you have a client that's diabetic, let's say they fall asleep on the couch. An hour later, you go to wake them up, and you're not able to wake them up. But they're breathing, you see them breathing, check their blood sugar, and then call us or call 911 accordingly if you feel more comfortable with that. There's also something known as diabetic ketoacidosis, or DKA, and that's when somebody's blood sugar is way too high, and there are specific treatments for that as well. But just know, if somebody is barely responsive or they are not responsive, if they're not responsive at all, you should be calling 911. If they are very minimally responsive, check their blood sugar, because if it's low, let's say their blood sugar is 50, we might be able to give them some orange juice, bring them back up, and then give them more food or something else to bring them back up to where they need to be. So just know, if you see something like this, a change in a level of consciousness, check their blood sugar. Even if you do call 911, check their sugar while the 911 EMS is on their way. It's really important to do this. If you have any questions at all from anything that I've talked about in this presentation, I've listed my email as well as the nurse's email. Feel free to reach out to anyone on the nursing team and we'll be able to help you. All right, thank you so much.